Welcome dear doctors to Kids Covery, where we are discovering and recovering our cute little kids. This video is actually important. We must know that many children are suffering from inborn errors of metabolism, and one of the very common inborn error is phenylketonuria, and the 7th class is dedicated to phenylketonuria only. So what happens in phenylketonuria? See, I have created a beautiful mind map for you so that you can retain this phenylketonuria for a very good period of time. So what happens is that the phenylalanine can't be converted into tyrosine, okay, because there is a deficiency of an enzyme called as phenylalanine hydroxylase. But sometimes there is BH4, that is called as tetrahydrobiopterin. Write it, tetrahydrobiopterin. Alright, so this might be deficient. Okay, so what happens is phenylalanine can't be converted into tyrosine. This is one defect. And yes, phenylalanine hydroxylase is deficient in most of the cases, and sometimes tetrahydrobiopterin is also deficient. So in order to realize what is happening, so understand that phenylalanine is actually converted into tyrosine normally with the help of an enzyme called as phenylalanine hydroxylase, which is accompanied by tetrahydrobiopterin BH4. If someday there is a deficiency of phenylalanine hydroxylase or even BH4, phenylketonuria is going to occur. Now a lot of students get confused, sir, what is the enzyme? So simple, P for phenylketonuria, H for hydroxylase. Okay, so don't forget the name of enzyme ever in your life. H is going to be hydroxylase. Okay, so this condition is autosomal recessive. Actually most of the inborn errors are autosomal recessive only, except like Hunter's, I told you, that's X-linked recessive. So what is going to happen in phenylketonuria? The tyrosine is not getting formed, and if you know from the subject of biochemistry that the tyrosine is responsible for the formation of DOPA, and this DOPA is further responsible for the formation of melanin also. So if there is no tyrosine, there is no DOPA, there is no melanin. So because the DOPA is decreased, there will be no dopamine, and what is going to happen? There will be intellectual disability which is going to happen. After that, the melanin is also less. So can you understand? Phenylalanine, tyrosine, okay, just remember a black color tire, okay, a black color tire. So remember, tyrosine is responsible for all the black means melanin, okay, so from all the nins like dopamine, melanin, okay, so all these things, melanin and dopamine especially, you can remember dark black, so D for dopamine and M for melanin. These both require phenylalanine for their production. So because the dopamine is not getting produced, there is intellectual disability. Because the melanin is not getting produced, there is hypopigmentation. One more important thing, there will be eczema also, and yes, there is a mousy or a musty body odor which comes from them. Okay, so please remember, mousy and musty odor is again important. MNOP, P for phenylketonuria, M for melanin, and M for mousy odor also. Okay, so how will you screen them? Of course, the serum phenylalanine levels will be increased, and you will have a white matter injury on MRI just because the dopamine is not getting formed properly. So what you have to do, please limit the dietary phenylalanine. Please increase the tyrosine from the diet because it is not getting formed. And one important thing is aspartame or the artificial sweetener is there. They are known to contain phenylalanine, and we don't want phenylalanine. So please, aspartame should not be given, as the spelling says aspartame, that aspartame, S should be stopped, and P for phenylketonuria. So aspartame should be stopped in phenylketonuria. But one important thing is in phenylketonuria, so okay, I'll write like this, ketonuria is ketenuria. So 10 means if you are giving the treatment in first 10 days, you can prevent the child from having the intellectual disabilities. So if you are treating in the first 10 days, the IQ of the child is going to be normal. Okay, so just you have to remember that the major reason is phenylalanine hydroxylase, but yeah, of course the minor reason is tetrahydrobiopterin also. So in the treatment, what you can give in the treatment, of course these things are important, but BH4 supplements have also shown a very good results when it comes to the recovery from the phenylketonuria. Thank you so much for joining. We'll see you in the next video.